But we want to talk about the latest trends in insurance, right? Let's get to our friend Eric Calicano, I should say, joining us. And Eric leads the benefits advisor for New City Insurance and talking about healthcare trends and the fact that 44% of Americans would switch jobs for better insurance company if that insurance covers things like Ozempic, and that's a weight loss drug. Eric, how are you today?
I'm great, Don. How are you doing today?
Doing great. So tell me about it. So we've heard about the obesity epidemic in America for adults and kids. On average, people gained at least 19 pounds during the pandemic. Is that, in your opinion, one of the reasons why this would be such a popular idea for people to search for an employer and say, I want the perks, I want those weight loss medications to be covered by my new insurance company?
Yeah, absolutely. With over 40% of U.S. adults having obesity, then it's certainly an issue for many individuals who would want the coverage for themselves and also potentially for their other family members, spouses, and children.
And so take me through it as far as insurance companies and insurers. How does this impact the industry then, Eric? If a company is looking to looking to attract more talent as far as its workforce, and they know this, how does that impact then the insurance industry? Because maybe a company is going to say, or a group of companies are going to say, you know what, we want to go with insurer X who provides these things, which ultimately are going to attract a higher quality employee.
Yeah, it's a very complex situation because you have a lot of competing interests. So certainly the individuals who have obesity have indicated, and that survey result of the 44% of individuals that would change their jobs to have coverage, and that was a survey released by the Obesity Action Coalition, that indicates this is really important for a lot of individuals. But the trade-off is, for employers, they realize that this could help them with attracting and retaining higher quality employees because they're providing the coverage that those employees want. But the cost associated with that could also make premiums so high that they price their own benefits away from their competitors. And so, because an example of that is that estimated by the CDC, the cost of obesity per individual per year, more than somebody who's not obese, is about $1,900. When you compare that to the cost of these drugs are all over $10,000 at this point. So the costs are very high. And so we're actually seeing a lot of employers pull back and reduce their coverage here or just state outright, we're not going to be covering these weight loss drugs, because ultimately if that cost of those drugs of more than $10,000 per individual for an annual prescription is going to be passed along to those individuals and to everybody else in the company in terms of higher premiums on their health plans.
So a big impact here. I find this fascinating. And then when you think about, the job market, is the job market looking any better? Because I'm always reporting on the numbers for jobs. The latest one was not as great. It fluctuates, after the pandemic, obviously. But is this something that could actually incentivize people to look for a new job, or maybe they're working part-time even since the pandemic? Does it incentivize people even to get back into the job market?
I could certainly see that being the case. I know that for many individuals, a major reason why they will want to be back at work is because it provides them their lowest cost and most effective healthcare options. And so if this is a specific piece of that healthcare that they're looking for, then that is just an added incentive, an added carrot to come back.
Yeah, I hear you. All right. Well, Eric, we thank you so much. We love to check in on the latest trends in the insurance industry business. Eric Calicano, thank you so much for joining us today.